you're doing everything right. Taking your blood pressure medication every single day, your numbers look good on paper, but you can barely make it through the afternoon without needing a nap. Your doctor says your blood pressure is under control, but nobody's talking about why you feel like you're dragging a weight behind you everywhere you go. Here's what they're not telling you. Beta blockers don't just lower your blood pressure. They're systematically shutting down your body's ability to produce energy at the cellular level. I'm Dr. John Kim, and I've seen hundreds of patients trapped in this exact cycle, told their fatigue is just stress or aging, when the real culprit is sitting in their medicine cabinet. And you need to watch this full video because the solution isn't another prescription. It's a protocol that addresses the root cause of why your body became dependent on these medications in the first place. Let me be clear from the start. I am not telling you to stop your beta blocker. That would be dangerous and irresponsible. What I am saying is this. If you understand the mechanism of how these drugs work, and more importantly, what they're stealing from your mitochondria, you can have an intelligent conversation with your doctor about alternatives, or at minimum, how to protect your energy while you're on them. So let's talk about what's really happening inside your body. Beta blockers work by blocking beta adrenergic receptors. These are the receptors that respond to adrenaline and noradrenaline, your body's natural go signals. When you block these receptors in your heart rate slows down, your blood vessels relax, and yes, your blood pressure drops. Sounds perfect, right? Here's the problem. Those same beta receptors aren't just in your heart. They're in your muscles, your liver, your fat cells, and most critically, they're involved in your mitochondrial function. Your mitochondria are the powerhouses of every cell in your body. They take the food you eat and the oxygen you breathe and convert them into ATP, the energy currency your body runs on. When you block beta receptors systemically, you're not just slowing your heart, you're putting the brakes on your entire energy production system. And here's what makes this even worse. Beta blockers specifically interfere with your body's ability to release and burn stored fat. Your body has two main fuel sources, glucose and fat. When you're at rest or doing low intensity activity, your body prefers to burn fat for fuel. It's cleaner, more efficient, produces more ATP per molecule. But beta blockers block the exact receptors on your fat cells that tell them to release those fat stores into your bloodstream. It literally shuts down a process called lipolysis. So what happens? Because you can't access your stored fat, your cells are forced to rely almost exclusively on glucose, which burns faster, less efficiently, and leaves you in a constant state of energy deficit. This is why so many patients on beta blockers gain weight, especially around the midsection. Your body can't access its fat stores for energy, and you feel exhausted because you're running on the metabolic equivalent of fumes. But it gets deeper. Beta blockers also lower your CoQ10 levels. Coenzyme Q10 is an absolutely critical nutrient for mitochondrial ATP production. It sits right in the electron transport chain, the final step where your mitochondria actually create energy. When beta blockers deplete CoQ10, you can't produce energy efficiently no matter how much fuel you throw at the system. And here's the cruel irony. The same cardiovascular system your doctor is trying to protect with beta blockers is the system that suffers most from CoQ10 depletion. Your heart is the most energy demanding organ in your body. It never stops beating, and it relies heavily on CoQ10 to function. So while the beta blocker is slowing your heart rate, it's simultaneously starving your heart muscle of the nutrients it needs to contract effectively. This is why patients often describe this specific type of fatigue as, "I feel weak, I can't catch my breath, my legs feel heavy." It's not in your head, it's mitochondrial dysfunction. By the way, if you are tired of being told your labs are normal when you know something is wrong, hit that subscribe button. We are building a community that demands real answers, and I want you to be part of it. Let's talk about what your doctor probably didn't discuss with you, the metabolic consequences. Beta blockers don't just affect energy, They directly impair your body's ability to regulate blood sugar. Beta receptors play a role in gluconeogenesis. That's your liver's ability to produce glucose when your blood sugar drops. They also help with glycogenolysis, breaking down stored glycogen into glucose for quick energy. When you block these processes, your body loses its ability to maintain stable blood sugar between meals. This is why so many people on beta blockers experience hypoglycemic episodes, irritability, brain fog, intense carbohydrate cravings. And if you're pre-diabetic or diabetic, beta blockers can mask the symptoms of low blood sugar. You might be dropping into hypoglycemia and not even know it until you're confused, sweating. So let's address the root cause question. Why did your blood pressure go up in the first place? Because here's the truth. High blood pressure is not a beta blocker deficiency. It's a symptom, a downstream manifestation of deeper systemic issues. In functional medicine, we look at the terrain, not just the symptom. And in most cases, elevated blood pressure is your body's compensation mechanism for one or more of these root causes. Chronic inflammation, particularly vascular inflammation driven by oxidized LDL, insulin resistance, and endothelial dysfunction. Your endothelium is the inner lining of your blood vessels. When it's damaged by sugar, chronic stress, it loses its ability to produce nitric oxide. Nitric oxide is your body's natural vasodilator. It keeps your blood vessels relaxed and flexible. When you can't make enough nitric oxide, your vessels constrict and your blood pressure rises as a compensatory mechanism to push blood through narrower pipes. Another major root cause, autonomic nervous system dysfunction. Your autonomic nervous system has two branches, sympathetic, fight or flight, and parasympathetic, rest and digest. When you're stuck in chronic sympathetic dominance from stress, poor sleep, blood sugar swings, your body is constantly releasing adrenaline and cortisol. This keeps your blood vessels constricted, your heart rate elevated, and yes, your blood pressure high. Beta blockers artificially block this, but they don't fix the underlying autonomic imbalance. They just suppress the signal. Specifically, the sodium-potassium pump and magnesium status. Your cells rely on a delicate balance of sodium and potassium to regulate fluid balance and vascular tone. When you're deficient in potassium or overloaded with sodium or critically low in magnesium, your blood vessels can't relax properly. Magnesium is nature's calcium channel blocker. It helps your smooth muscle cells release and your vessels dilate. Most people are walking around functionally deficient in magnesium, and instead of repleting it, we prescribe a drug to force the same outcome. So here's what a root cause approach looks like. First, if you're on a beta blocker, you must supplement with CoQ10, minimum 200 to 300 milligrams daily of ubiquinol. This is non-negotiable if you want to protect your mitochondria and maintain energy. Second, support your nitric oxide production naturally. This means eating nitrate-rich vegetables like arugula, beets, spinach, and crucially, it means optimizing your oral microbiome because certain bacteria right on your tongue convert those dietary nitrates into nitrites, which then hit your stomach acid and become nitric oxide. This is why using harsh antibacterial mouthwash every day can actually destroy this pathway and raise your blood pressure. Third, address your autonomic nervous system. I had a patient a while back who was on a maximum dose beta blocker, but his blood pressure would still spike every afternoon. Why? Because his nervous system was locked in a constant state of hypervigilance. He was checking emails at 11 p.m., drinking 4 cups of coffee, and barely sleeping. We didn't just change his diet, we implemented a rigid nervous system protocol. This is where breath work, specifically 4-7-8 breathing, heart rate variability training, and daily vagus nerve stimulation come in. You need to actively teach your body how to feel safe again and shift out of sympathetic overdrive. Beta blockers won't do that for you. They just mute the alarm bell while the fire is still burning. Fourth, fix your mineral status. Get a comprehensive metabolic panel. Check your magnesium RBC, not serum, and your potassium levels. Supplement with magnesium glycinate, 400 to 600 milligrams at night. Increase potassium through food, avocados, sweet potatoes, spinach, or discuss potassium citrate with your doctor if you're deficient. And fifth, stabilize your blood sugar. This means eating protein and fat with every meal, eliminating processed carbohydrates, and potentially using continuous glucose monitoring to see how your body responds. Because if your blood sugar is spiking and crashing, your sympathetic nervous system will stay activated and your blood pressure will stay elevated. Now, I want to be very clear about something. This is a process, not a light switch. You don't just stop the medication and hope for the best. You work with a provider who understands functional medicine and cardiovascular pharmacology. You monitor your blood pressure closely, you track your symptoms, and you make gradual, intelligent adjustments based on data. Some patients will always need medication, and that's okay. But even if you stay on a beta blocker long term, the strategies I just outlined will protect your mitochondria, improve your energy, and give you your life back. If this resonates with you, don't guess with your health. Click the link below to book a discovery call with my team. Or, if you want to go deeper into that mineral imbalance we just talked about, watch this video next on the #1 mineral deficiency causing your anxiety and heart palpitations. I break down the exact forms you need and what your doctor is missing. This is Dr. John Kim, and I'll see you in the next one.